Oh hi, I'm Drew Lee and welcome to my channel Amp Drew Lee. I hope you've been enjoying the videos so far. If you do like them, please like, subscribe and press the button because the ball is starting to roll from next week, which I will update you on. So today I had a counselling session with one of the amputee counsellors. But yeah, watch the video and you'll find out what is shimmying, what's a cooking. So without further ado, here we go. Good afternoon, Drew. My name is Doctor to the left. I do prefer to go on a first name basis. My first name is Eileen. And I am here with you because Dr. Lala said that you would benefit from counselling. Now I normally do this with amputees that already had the leg or the arm or the limb off. But you're special. Hello, nice to meet you. Can you give me a little bit of background with your leg and with yourself and your mind and your brain? I just want to get a little bit of insight. I mean, I was told you was on a swing. I'm hoping it's at the children's park. It was at a children's playground when I was with my family. It was not in a dark room. Filth. Right, so, do tell. So it all happened 2 days before the first big lockdown in 2020, and I was at the children's playground with my family, and as you do, you just jump off a swing. I landed wrong, and then here we are today. I get bored fucking talking about it. Poor you. Right. There are a few things that we can try. I mean, I'm not sure what is more suitable at the moment. But let's try this, okay? Lie down and close your eyes. I say close your eyes. Now, imagine you are on a field. Imagine you are just laying there. You feel the soft breeze go through your hair. You are loving it, loving life. Now, what is the first thing that you think of? Oh, I could do with a fag. Light one up! So you quickly get up, you quickly light that fag, and it feels and smells and tastes amazing. And then you lie back down, you go back into that zone, now that you've had that cigarette. You feel the wind in your hair, you are loving life, you are just in a field. Now what do you feel? Oh, my legs are in. And how do you think that would go away? Yeah, but there's nothing that anyone can do, and I'm not going to be drugged up to the nines, and it's just painful all the time when I first wake up, and then before I go to bed, I just wake up and I just pain, Right, let's try a different approach. So you are here. And at the moment, there's all this bollocks going on until the surgery. Yeah? So what we can do is so then once we've done all of this, I think it would be the success to happiness. Okay, fab. Thanks, Eileen, to the left. Hope hope you enjoyed that. I did enjoy doing that little bit of shimmy in there. No, I did not do the fall asleep exercise, but she did draw on the whiteboard, which I will get to in a little bit. So yes, Dr. Lala, he recommended that I spoke to Eileen to the left. Because my mental health at the moment is just like taken a dive, partly due to the pain and maybe as well my leg just needs to get fucking chopped off, and it did seem like it was a help. So I gave her a little bit of my background, told her about my family, told her about my job, told her about everything, past, present, blah blah blah. She asked if there was any depression in the family. I said, well, my dad looks like Afghani and I look like Rose West when my hair ain't cut. But, actually didn't. But, yeah, we spoke about a lot of things. It was a bit difficult for her at first because she normally does counselling for people that have already had the amputation done. Now, I'm waiting for that, so I've still got all limbs, nothing's been amputated. So it was a little bit difficult for her because she's kind of got to put herself back a step before that initial amputation, whereas her normal line of work is from the amputation onwards. But she did say the things that we're going to discuss and go through and techniques that she could possibly do to help. She did say that they are also effective for once you've had the amputation as well. She did ask what my aim was from this, and I just thought, well, I was offered this because I've lost the will to live. But thinking about it, when I was in the room, I did say, well, it's all good for me to get in that mental state, and it's also because I've had a history of depression, and I thought it was somewhat a good idea to kind of be ahead of the game. So I'm working on my mental state and to carry on being positive and to move into a positive direction. So when the amputation's done, the shock won't be as great, or the mental side, if there are any other niggly bits, that is kind of starting to be in progress. So if my brain's going down like that and there's other issues, not that there is other issues, the main issue is the fucking leg. But yeah, I thought that it would be good, you know, to at least be working mentally into a positive direction in general and speaking to someone, especially now that I'm going to have a life-changing operation. She did use the whiteboard, and I actually thought that it was really good. I don't know if anyone else has had counselling, not specifically for amputations, but maybe for depression, or if they're feeling down, or if they're having any other personal or whatever issues they've got. People suggest, oh, try this technique, try this, here's a piece of paper, fill this form out, do this, and what's your score from 1 to 10, and all that stuff. And, you know, you walk out and you just think, oh, fuck off. Or sometimes you feel deflated and you're like, oh, I've just poured out my guts and nothing's really come about. I did say to the person, I did say to the counsellor that A&E counselling, all it is a box ticking exercise, and I do not, my local hospital, I avoid. There was one time I spoke to a certain young girl. She was more bothered about ticking boxes, filling in the forms, signing a piece of paper. She's one of them that probably practices her signature in school, probably someone like that. Saw her once, hated her, went back into A&E, and then, oh, would you like to speak to a counsellor? I said, well, as long as it ain't that girl with the signature and the box ticking, I ain't fucking having her. Guess who it was? Her. She was behind the curtain, and I went, oh, I ain't fucking speaking to her, she's a waste of oxygen. And they withdrew the curtain. She was like, well, I ain't bothering. Filth. True story. So, anyway, I've gone on a tangent. Back to what I was saying before. She used the whiteboard, and even though I took the piss and I just wrote whatever and scribbled whatever, the techniques, or the kind of things that she wants me to think about, she put on the whiteboard, and she did like little diagrams or, you know, whatever, and drew graphs or whatever you call it, a Venn diagram with 3 circles and something, a circle here with a couple of arrows pointing, and I said to her, seeing that visually was a big help for me, because now I'll remember those diagrams that she drew, so then if something starts to go a little bit down here or slide there, I've got something visually to remember and say, well, hang on a minute, Eileen to the left drew that picture, what shall I do about this situation? She did 2 diagrams, so I've got 2 options for the week, and I mean, I can always share that with you if anyone's interested. More than welcome to write in the comments, or you can message me, or, you know, TikTok, Instagram, Facebook, all that malarkey. I'm more than happy to share that with you, what some of her techniques are, and I thought they were really good. So I'm going to see her again the day after I speak to Colonel Mostardo on the video. So next week's going to be a busy week for me, and of course I'm going to update you. But yeah, all in all, I thought it was pretty good for me to just kind of just talk about things and even if it weren't related to my leg, it was just good to talk to someone. Yeah, I've got my friends, I've got my family, I've got a nice select group of people to talk to, but at the same time, I don't always want to bore them to tears with what's going on with me. They know that I'm in pain, they know that I'm struggling, they know that I'm losing the will, but I don't want to be negative on them all the time, do you know what I mean? So talking to someone it was just nice for a change, and also not knowing that person, so they're not judging me on, you know, because I said to her, I like a fag, I like a beer, I like a cheeky glass of wine, and I told her I was doing the Amputee, and she thought it was a good idea that, you know, it's a good way for me to, you know, keep myself occupied as well. And for me, I just want to make it positive for other people and let people know, even if health issues are shit, or even if you're dealing with other issues, I do think that it is, you know, well for me anyway, doing the YouTube channel, doing something that you enjoy and something that you can let a release out of and achieve something, you just think, you know what, you forget all the shit, and I enjoy doing it, and if I can help someone else just by someone laughing watching my videos or whatever, then so be it. And if I made one person laugh, then I'm happy, and I enjoy doing it. So I will keep you updated. Next week's going to be my chat with Colonel Mostardo, which of course you'll be the first to know. And then if I have time as well, which I more than likely will do because my social calendar is full, I'll update you on that if there's any progress. I mean, if there's not really any progress, I mean, I won't fucking do it, will I? Otherwise you'll be fucking bored. But yeah, anyway, sorry, rambling. Right. Be easy, but not too easy, and I will see you next week. Alright? Take care. Bye.